I'm very happy to welcome you to the first panel of our conference. We started before with a roundtable on COVID-19 and NGOs and civil society. And now on this first panel, we are traveling to 4 different continents, getting a comparative perspective on the dynamics of the scale between the states and NGOs or civil society. So, as I said before, we will take a look into Brazil, Israel, the UK, and South Sudan. So I'm very happy to have such an international crowd with us. The procedure would be as following. We will have all 4 presentations in a row. Then afterwards, we have a discussant, Dr. Alisa Bellotti from our Haifa Center for German European Studies. And I would really like to encourage you to add your questions to the chat. And I will make sure that we have in the end time for a Q&A and for questions. I would also introduce each speaker when it's his or her time to speak. So you will still freshly remember whom we have. But in general, I'm very happy to welcome to the panel Natalia Bueno and Leonardo Bueno, Hillel Schmid, Piergiuseppe Parisi, Marynka Marquez, Alisa Robinson, and Peter Justin. These are our panelists today. And we will start with Natalia and Leonardo Bueno, who will give us a short input of their works on slum settlements in Brazil, and asking the question if this is the time when we can now work together. And Natalia Bueno is an assistant professor at Emory University in Atlanta in the US. Her main field are comparative politics and world politics. She also studied in Sao Paulo in Brazil, so it's very fitting also for this panel. And Leonardo Bueno is just conducting his PhD at the University of Sao Paulo, and his focus is economics and public administration. So without any further ado, I would like to hand over to Natalia and Leonardo. Please unmute yourself, and let's try if you can share a presentation if you have one.
All right. Thank you so much, Katharina, and everyone. I'm going to start sharing my presentation. And Leo is also here, part of our co-author group, and we'll be both be answering questions, and we look forward to discussion. So, all right, can you all see my slides?
Yes, perfect.
Wonderful. Thank you. So first thing, it's a work in progress. So we, as in typical fashion, we change our titles. So they're going to be discussing some work in progress we have been doing with an NGO in Brazil about the effects of their programs on well-being, solidarity during the COVID-19 crisis in slum settlements. The motivation for this project is that low-income populations are the ones that are the hardest hit by the COVID-19 pandemic in general globally, but that's also true in the Brazilian case. And dwellers of informal settlements are particularly unprotected due to not only densely populated settlements, but also the lack of adequate housing, which is something obviously important in a situation in which social distancing and quarantining are relevant safety health measures, but they're also vulnerable in the sense that they have their private and the public safety nets are less well developed than compared to populations outside of these slum settlements. Furthermore, there's a lot of mistrust from government institutions that could provide more reliable information on how to combat COVID-19. And the NGOs here play a key important role. State welfare programs are often insufficient in those for those dwellers, and public infrastructure is often lacking. And in this context, NGOs and these other non-state welfare organizations take the lead in terms of providing welfare and providing often information about how to deal with the COVID-19 pandemic. The intervention we're going to be looking at today tackles exactly 2 key issues related to how to deal with the COVID-19 pandemic. One is they tackle poor housing quality, but also access to personal assistance networks. And I'll describe how the NGO program, their intervention, tackles these issues in more detail quickly. And I should note that this intervention was conducted by this Brazilian NGO. It's actually an NGO that is part of a Latin American network of NGOs prior to the COVID-19 pandemic. And then we are examining the outcomes during the COVID-19 pandemic to see how this intervention might have affected the outcomes for this population during the crisis. So we're going to be discussing two questions here today. Does the intervention create better? Does intervention that creates better housing quality mitigate the fallout of the pandemic among slum dwellers in Brazil? And does this intervention that we believe strengthens personal assistance networks among slum dwellers create more solidarity among them in the Brazilian case? And solidarity is a key issue here because of the lack of access to this kind of public and also more vulnerable personal assistance networks, given that a lot of the help and support that these groups receive is among members of their own community. So the first hypothesis we're going to be examining is that we're examining is that NGO beneficiaries have higher levels of mental well-being compared to non-beneficiaries. You also look at more material forms of well-being, and I'll discuss that in a second. And the mechanism by which we think this better housing quality leads to better well-being compared to non-beneficiaries, especially in the context of COVID-19, is that better housing quality alleviates the pressures of being locked down that we all know too well. The second hypothesis we'll be examining is that NGO beneficiaries have more access to solidarity networks than non-beneficiaries. The point and why we think that is true, the mechanism underlying this hypothesis is that individuals who work with others in the process of building their own homes have developed more relationships with other members of the community. And I'll explain in detail how individuals have worked with others to build their own homes in this context. So as a bit of context, slum dwellers make about 33% of the global population. And even though we are doing a very micro impact evaluation type of analysis, we hope that this will speak to other dynamics in similar slums across the globe. In Brazil specifically, about 50 million individuals live in slum settlements. And these settlements are the ones that have higher fatality rates than non-slum neighborhoods and also are suffering from more socioeconomic distress from the COVID-19 pandemic. To give you a very brief sense of what the conditions populations are living in, about half of our sample, 46% of the families mentioned having difficulties in buying food. 58% started to buy cheaper supplies since the beginning of the pandemic. And about 45% of them were unemployed at the time, given that the unemployment rate in Brazil around the same period was about 12%. So it's a population that is much more vulnerable than the average Brazilian. And in a bit more context, our partner NGO who has been developing with us, it's a true partnership, this project and also our hypothesis, they work in 6 major states in the country, and they have access to about 40 slums, and they promote development activities in a lot of them. So their mission is to reduce poverty by alleviating emergency conditions of households and providing community capacities, which shows that they have this dual goal that is both about improving housing quality, but also about empowering these communities to improve themselves through this kind of social development of social skills. So the organization, TACHO, believes that by improving community capacities, leadership, engagement networks, people living in slums can find their own ways out of to leave poverty. The work we did with them, with their kind of like key program that we evaluated with them, was across 25 community slum settlements with 611 households that were assigned to either treatment or control. And going now to the study design, what we did was the following. In early 2019, we did a baseline study with families that applied to their program. So they have this program that improves housing quality and people apply to them. We interviewed all of them, and we used that to create the list of beneficiaries who might or might not be eligible for the program, and also to select them via this randomized lottery list. The issue with the list is that there's more demand than supply of houses. So the organization has to come up with a rule to decide who gets a new home or not. And they have some eligibility criteria, and we use them, but there's more demand than supply. So to select those who would receive the house, they used a randomized lottery. And that's how we worked with them, implemented this randomized lottery, which is also, of course, also very helpful in evaluating the impact, the causal impact of these homes into a lot of interesting outcomes. Then we were expecting we didn't expect a pandemic, so we hoped that this project would last throughout 2020. We stopped, of course, as soon as the pandemic hit in Brazil, so we haven't built any houses since February 2020 as part of this project. And in mid-2020, we did a midline survey via phone with those who had been assigned to treatment and control to receive a home versus not. And now we are conducting the endline survey to measure more longer-term outcomes. And it's a survey in progress. So thank you all for listening to Work in Progress. The intervention itself is, like I said, a partnership, and it randomly assigns poor households in slums receive these prefabricated, affordable wooden houses. And these families have to work to build their own homes, so they have to work with others. They have to collaborate with their neighbors, their friends, community members to build their own homes. And before they even build their homes, the NGO also provides a series of workshops that not only teaches them how to build houses, but also how to operate and cooperate with each other. And to give you a sense of what these houses look like and what this intervention means on the ground, this is the type of conditions that people are living in. So these are vulnerable slums. There's a wide variety of slums that have more or less infrastructure. This organization focuses on the ones that are most vulnerable. And this is the house that they are giving. So it's a incredible improvement in terms of the quality of their homes. Now the houses have actual walls and a roof and also a floor, which we theorize have a great impact on several different aspects of people's lives. However, there are a few things to keep in mind here is that even though the housing quality remain, there are a lot of things that do not change. First, people stay in the same piece of land, so they're not moving to a different location. Also, a lot of those settlements don't have property rights. And by receiving a better home, people do not necessarily receive property rights. They don't receive property rights via the NGO, at least. And even though the home has a lot of improvements in terms of infrastructure, there's no sanitation infrastructure provided by the NGO itself. And a lot of these settlements do not have also sanitation infrastructure. So it's up to the dweller if they want to build, for instance, toilets or having running water is not provided by the NGO itself. And the beneficiaries only receive the house if they get engaged in the construction process. So they participate in meetings, they must engage with neighbors, they must work with neighbors to tear down their old home and spend nights in someone else's home until their home is finally built. So we think that the NGO provides this intervention that is a bundle that both gives better housing quality, but also improves networks and ties and community embeddedness at the same time. The outcomes to test our hypothesis are the following. We're going to be looking at well-being. So we're going to be looking at well-being index that is composed of questions related to feelings of happiness, feelings of worry, concern, sadness, isolation, loneliness, sleep quality, mental health medication, and stress. And the reason we're focused on mental well-being rather than, let's say, material well-being is that there's a few other studies looking at the similar intervention in other countries in Latin America that do not find a lot of effects on material being, such as like income, finding a job. So we don't think necessarily that receiving this home is going to lead to changes in those material beings, and we do not find that. That's why we focus in mental well-being. And the solidarity index is composed of a series of questions on whether or not the person can count on family, friends, community members, church members, community leaders, in case they fall sick, if they had health problems, and especially related to COVID-19 health problems. We also ask about if they provided aid to other families and if they received aid from other families, aid in terms of buying food, childcare, and other issues during the pandemic. All right, so how do we analyze this? Because we have the randomization, it's actually a very simple comparison. We're only comparing treatment, those assigned to treatment, who received the home, versus those who did not receive the home. And that should give us a consistent estimate of the effect of receiving those home on the outcomes we care about. The randomization, just quickly, is done at the community level. in the sense that we take everyone in the community who applied and we assign treatment control. So it's a block type of randomization, and we control for that. We also add some pre-treatment characteristics, measure the baseline to improve to get more tight estimates, and we use different types of estimators to deal with the fact that we have unequal probabilities of assignment to treatment across slums. But we're going to focus here on our estimation that we call this intent to treat, because not everyone who received the home necessarily gets it, because there might be issues in the construction and also in the engagement with the process. All right, so the first results here. So this is looking at the results for mental well-being, and we do find that receiving this home increases quality, well-being, mental well-being. We have this index, but if you break it down to the questions we care about, here we see the increase in mental well-being. We see that it's mostly driven by decrease in levels of being worried, feeling concerned, decrease in levels of feeling lonely and isolated. And also we have this behavioral outcome, which was a bit surprising to us, that there also have fewer individuals taking mental health medication. So those who NGO beneficiaries do see an increase in terms of their mental health in general. However, we did not find evidence, and I'm not showing here, but I'm happy to show during Q&A, that these individuals are necessarily staying more at home, or that they're complying more with COVID-19 preventive measures. So the mechanism that we had initially theorized, that the intervention leads to make it easier to stay at lockdown and staying at home, is not necessarily the one we think is explaining these results. Because people not staying, those who received the home from the NGO are not staying more at home than those did not. They're not necessarily leaving less, and they don't have necessarily more strict measures against complying more strict measures against COVID-19. So we are in our second analysis now, we're looking at these other pathways that may affect mental health well-being and how the intervention might create that. And we think we're testing this now in the field that might be more related with the fact that the home is less likely to crack down with heavy rains. There's less rats and less cockroaches and things like insects in general in the floor. So they're not necessarily related to COVID-19, but other features of the quality of the home. The second set of results look at solidarity. And here results were disappointing. We necessarily don't really find a lot of changes in the increase in solidarity among NGO beneficiaries. So the second arm of the intervention the NGO wanted to increase was more this collaboration among slum dwellers, and we don't see that in our findings. So we find that the estimates are positive, but they fail to be statistically significant. We find some effects across for specific types of cooperation with friends and church members, and we find it here and over here. There's increased solidarity just among those who can say they can count on friends and counting on community members. And we think that what we're theorizing now is that the intervention might, instead of creating necessarily new ties, what it's doing is strengthen existing ties. And that don't necessarily lead to this overall average increase in solidarity, but it does lead to perhaps a strengthening of ties that were already strong to begin with. So overall, we find no evidence that intervention moved individuals toward having more access to the solidarity networks that were particularly important during COVID-19. Descriptive, though, we're not showing it here, but we have to discuss in the Q&A, we find that intervention did increase connections between members of the community and community leaders. So it's not that the intervention itself did lead to this first stage, that is just making connections and staying in touch with people, but those connections don't necessarily translate into people helping each other more during the COVID-19 pandemic. We also found that the intervention led to longer tenures at the community, so less geographic mobility, given that individuals don't have property rights and the settlements are often not regularized. There's a lot of movement. People move a lot to different homes. And we found that the house itself led people to stay put more. And then we think that might have maybe longer term impacts into developing more solidarity, since people are staying more longer in their communities. Finally, some concluding remarks. We found that this housing infrastructure led to better outcomes related to mental health. We also found that intervention also increased these networks and strengthened previous ties and reduced geography, but they don't necessarily translate into more solidarity. We are now looking at topics that are more closely related to the theme of this conference on NGOs and civil society in general. We do find that the intervention and working with the NGO has increased perceptions and about NGOs. So it has increased their positive views about NGOs. It has increased trust in community leaders. So that's something we're exploring a little bit more now in our current work on how engaging with an NGO and non-state welfare provision changes people's views about civil society in general. So that's it. And thank you for listening. I look forward to comments and discussion.
Okay. Thank you so much, Natalia, also for shedding light on this vulnerable group of population. And again, it's still very full, although it's work in progress. And it goes very, very well also probably with our next speaker. I'm happy to have here Hillel Schmid, who will tell us not a love story between civil society and the state in Israel. And Hillel Schmid is a professor emeritus at the School of Social Work and Social Welfare at the Hebrew University. He's also a consultant to the Ministry of Welfare and Social Services in Israel. So he's like working also in between. And he focuses on the management of non-profit human service organizations and even founded an MA program that is dealing with non-profit organizations management. So it would be very interesting to hear from you. I give the floor for you, and all questions again always in the chat, and we will have a nice Q&A afterwards. So Professor Schmid, the floor is yours.
As it was said, my topic is no love story, the relation between CSOs, that means civil society organization during the COVID-19 pandemic in Israel. Basically, the main argument of this presentation is that the relations between the government and the CSOs during the COVID-19 crisis is mirroring or reflecting, in my opinion, the relations between them even before the crisis. And the crisis provides us an opportunity to dig more and learn more about these relations. I'm sure that not everyone will agree with my observation, but these observations are based on my studies during the years, especially the observation during the COVID-19. And I'll start with the background. The background is that my thesis or my argument is that the government, and I try to prove it in a few minutes, is very ambivalent and alienated towards the organizations. Secondly, the government during the crisis provided only limited and insufficient financial support to the CSO. Although they ask for more, they get less, and there were many difficulties to get the money. And actually, the money did not meet the needs of the organization. And in fact, many organizations failed to provide the services, shut their doors, etc., lay off people, and more. Also, in my opinion, the relations, as I started my talk, during the pandemic is some kind of a litmus test. In other words, I argue, as I have said before, that the relations during the crisis are only the tip of the iceberg. And what we can see, but 2/3 of the iceberg is down in the water with motivations and willings and aspirations and conflicts. And finally, for the background, we have to remember our unique political situation in Israel, that we have 4 times elections, and there is no national budget for the last 3 years. Hopefully, the new government will decide about national budget, but the country is without a national budget, which means actually that it makes the life of the organizations very tough and uncertain. What is the government policy, in my opinion? And I'm sure not everyone will agree with me, even in Israel, But what I realized is a few points, too many, but I'll try to summarize them. First of all, in my opinion, there is some kind of misunderstanding of the role of CSOs in the modern and democratic society. The government view, and I'll repeat it later, the CSOs as the long arm of the government to provide services. If you are looking on the structure of the sector in Israel, 80% of the organizations are providing services. And the government perceives them as a providers of services. But civil society means more. Civil society organization actually not only providing services, they advocate, they representing, they are mediating, they are buffering, they are lobbying, they are responsible for organization change and social change, but not only as providers technically of services. Secondly, in my opinion, CSOs are perceived by many politicians and many administrators, as well as high-rank officials in the army and in other institutions, that the civil society is some kind of a shadow state, some kind of a deep state that undermines the stability and resilience of the country. And if I combine the points 3, 4, and 5, there is a delegitimization of political opponents trying to silence critical voices, human rights organizations, and the judiciary. In fact, they are trying to restrict the activities and the autonomy. And there are too many laws and bills that are trying to do the work in terms of limiting the organization. I'll give you only a few of them, since we don't have a lot of time. I'll mention one of them. Actually, is the Budget Foundation Law of 2011 expressly denies funding to NGOs or CSOs on the basis of their political opinion. That legislation blocked funding to anyone denying the Jewish character of Israel. There are other many rules that are trying and bills that are trying to limit or restrict the work of the civil society. Another point, which is very not only relating to the civil society organization, the government used the Israeli Security Agency to follow those who were infected by the virus, and they used the technology to follow and trace people at home to see if they are in full isolation and following the instruction. The next point that actually proves what I'm trying to show in this presentation is the culture of the contract competition, marketization, and privatization. We see more and more for-profit organizations penetrating the areas which were controlled traditionally by non-profits in the provision of services. We see more and more for-profits that are actually providing services to the elderly, to the mental health, to children at risk, etc. And they are big competitors of the non-profit. You can say that there's no formal actually policy of the government, but in fact, they win and get more and more services. And the non-profits, for instance, in the home care services, 30 years ago, 70% of the market was provided services by non-profits, and only 30% were provided by for-profits. Nowadays, the opposite is true. 70 to 80% of the services are provided by the private organizations. And as I said before, CSOs are a service provider and not partners. The government does not relate to them as collaborators and partners. And even some of them view them as a double agents, which means double agents, they get the money from the government, but when they don't get the money and they are unhappy, they apply to the courts against the government, which the officials of the government are not unhappy with this move. Also, government relate to this organization as inefficient and ineffective. And if you combine points 10, 11, and 12, means that the government view the management of human service and non-profit human services in the area of provision of services that are still employing old management techniques and specifically poor financial and risk management. And in fact, in my studies and surveys, I learned that the people or the executives are not aware of new techniques of running the financial matters of the organization and don't have any idea about how to manage risk. Finally, non-profit human service organizations define their goals in a very ambiguous and amorphous way. The well-being, or to provide the well-being, or to ensure the well-being of the clients, rather than the government wants to see measurable and quantified objectives, that because if we use the contracting out of the services, we pay for the performance, we pay for results, we pay for not for the inputs, but for the outcomes. And all in all, it brings the government to think that these organizations are not efficient and are not adapted to the new reality that we face, not even by the pandemic, but also in normal time. But we cannot free the organization for being a partner to the attitude that I presented, and they are also partners, quote unquote, to the attitude that the government have towards this organization. And the reason for that is the following. First of all, the organizations are highly dependent on government funds. In fact, today, the situation is much better in my terms, in my perspective, because only 41% of the revenues of this organization on average is coming from the government. But 30 years ago, it was 63. And recently, 10 years ago or 5 years ago, it was about 50%. So the situation is better today, in my opinion. But still, there is a high dependence of the government on the funds of the organization. And because of that, we have found in our studies about advocacy and change that they don't buy the hand that feeds them. They just conform with the policy and regulation of the government in order to ensure the steady flow of the resources. And because of that, they don't bite or argue with the government. They just follow the instruction. And because of that, I see them as a partner to the attitude that I presented before. Thirdly, or secondly, is the high structural and organization differentiation and segmentation. The structure of the third sector in Israel is very differentiated, is typical and characterized by differentiation. We have many organizations, as in we support them, but when you have so many organizations, only 10% of them are the biggest organizations that control 80% of the budget or the revenues that is coming, the income of the whole sector, and 50% are small and 40% are a medium size. What we have learned that there is a duplication and redundancy. Sometimes you find the different organizations provide the similar programs to similar target populations. We are now at the end of a study of emerging in the nonprofit and the civil society organization. I am not sure this is the ultimate response or solution to make the organizations and the sector more efficient, but still we have to think that the differentiation or the high differentiation makes the sector very, very inefficient. Also, we can combine points 4 and 5 and see, only 4, sorry, that's about what I'm dealing here is about the unprofessional management and lack of technological innovation. And I want to emphasize the technological innovation, especially in times of the post-corona crisis. Unfortunately, we are not so post-corona crisis because we are now in the middle of a new outbreak here in Israel. But we have to think how to provide services not only in the center itself. We have to provide services to the elderly when they refuse or afraid to come to the daycare center and provide them with services. Unfortunately, what we have found that these organizations are still lack advanced technological innovation. And finally, I blame the poor performance of the board members. We choose and elect board members on the basis of their ties and connections with the officials and politicians in order to mobilize and to make fundraising and to be a part of the decision making. Unfortunately, in the time of the corona, during the last year, when the leadership of the CSO tried to recruit the board members to mobilize more support, it was a big disappointment because they were not effective and didn't do the job. In conclusion, what are my insights from the studies that I've done, especially in the time of the crisis? First of all, we have to work hard in order to change the government attitude towards civil democratic values and human rights. Because I believe, and as an Israeli citizen, I believe that strong democracy needs a strong civil society. I want to live in a country where the civil society is defending, preserving, promoting, advocating, etc., the needs and the wills and of the citizens. Unfortunately, till recently, this was not the situation because civil society, many of the civil society organizations were identified as those that I mentioned before as the deep state of the country. Secondly, we have to work harder in order to change the power dependence relation, what I'm trying to define as the power revolution. In the past, power was attached to the formal authority of the leader, of the management. Today, the power is attached to the knowledge, to the expertise, to those who can keep the information. And CSOs are keeping and controlling more information. They have more information about the clients, about the needs, about what they need, and actually they have to be more powerful and to change the power dependence and make the government more dependent on them rather to be dependent on the government. By that I mean also that in point number 5, the participation of CSO delegates in government policy making and decision making. That's not enough to be a long arm. The government has to be aware that there is a new definition of the roles. The government has to delegate and to decentralize more power and authorities to the organization. They know better how to cope with emergencies, with disasters, and with pandemics rather than the government. The government should be the regulator, the policy maker, but the provision of the services and being close to the citizens is the role and the responsibility of these organizations, in addition to the local authorities and many other institutions which are working in the field. Finally, we have to encourage more cross-sectoral partnership. It's not enough to work alone. We can get in a synergy by doing and encouraging and establishing cross-sector partnership between the government, the nonprofits or the civil society organization, and the business. Unfortunately, we see too little cooperation of the businesses, and we have to mobilize their support in order to do a better job, especially in times of emergency. And we know from the past, and we can predict to the future, that non-profit organizations, human service organizations, civil service organizations are much more flexible in responding to the needs than the heavy machine of the government. And the government has to be aware of that by allowing them to make the job and provide the services and not blocking them from achieving their goals. Thank you.
Thank you very much, Professor Schmid. This was really fascinating to get this insight and a critical perspective, and to see that this is just the tip of the iceberg, what we can see now in the crisis. I will gather the questions for after all the presentations for the Q&A, and I'm now handing over to the third kind of contribution, which is maybe telling us a love story. Now we had a non-love story, maybe we are talking about a better example. Namely, I'm very happy to have here Piergiuseppe Parisi and Marynka Marquez, who are both joining us from the Center for Applied Human Rights at the University of York. Piergiuseppe Parisi is a research associate there, focusing on international human rights. Marynka Marquez is a PhD student, also focusing on the implementation of human rights on a local level. And they will introduce us to their contribution on the co-production or the co-producers response to the COVID-19 pandemic in the city of York. So I already see that you're sharing your presentation. So I give you the floors and I keep collecting questions.
Yeah, good morning or good afternoon or good evening, depending on where you are. And many thanks for giving us the opportunity to present the research that we have conducted on co-production in the city of York during COVID-19, which is really part of a short-term project that we conducted in collaboration with the City of York Council and the York Human Rights City Network, a network of civil society organizations that work around issues on human rights. So I'll start by saying a few words about the rationale for this research and why we decided to focus on co-production in particular. Previous research that has been conducted in the UK shows that as the demand for public services increased during the pandemic, the voluntary sector has proved to be an essential ally for the public sector to deliver those services. And moreover, community and voluntary organizations played a fundamental role in identifying socially and economically vulnerable individuals, which we know have suffered the consequences of the pandemic and the restrictions imposed by the government far more than other sections of the population. And of course, the same dynamics that could be observed across the UK occurred in the city of York, which is the city where we reside and work. It's a small city in the northeast of England with a population of around 210,000 inhabitants, and it has a very vibrant civil society, being, among other things, the first human rights city in the United Kingdom. And as you will hear from Marynka, the pandemic prompted both the council and the community and voluntary sector to come up with several initiatives to support the population, especially those who are most vulnerable. And so what we wanted to understand really is how these collaborations between the public and voluntary sector have worked during the pandemic, and specifically whether there are practices that could be retained in the future. But we wanted to do this within a very specific conceptual framework. In particular, we wanted to understand whether and how these collaborations contributed to the realization of human rights. International human rights mechanisms have underlined the importance of a participatory approach between the state and rights holders in the design of policies aimed at fulfilling the normative content of human rights norms. Just to mention one, in relation to the right to health, included in the International Covenant on Economic, Social and Cultural Rights, the UN Committee on Economic, Social and Cultural Rights stated in its general comment number 14 that an important aspect of the right to health is the participation of the population in all health-related decision-making at the community, national, and international levels. And as I'm sure you're all familiar with, the collaborations I've been hinting at can be broadly defined as co-production. This is a term that we borrowed from public administration studies, and it indicates a bit of a slippery concept. And I guess that the best definition that we could find is probably the one that we include in our draft paper. That is, and I'm only going to quote a part of the definition, a process through which inequalities in power are acknowledged and addressed to facilitate collaboration. Co-production is about bringing together citizens, communities, patients, and or service users with those working in a given sector. And the definition goes on. This draws otherwise excluded perspectives and understanding into strategic and procedural decision-making processes, and makes the most of everyone's different skills, knowledge, experience, and ability. Now, this definition resonates quite strongly with some of the elements that define human rights-based approaches. These elements are best defined by the so-called panel principles, which were first conceptualized in the human rights and development literature. And for those of you who are not familiar with the term, you can see from the screen that P stands for participation, A for accountability, N for non-discrimination, E for empowerment, and L for legality. And so you can see how the notion of co-production, as we have defined it in earlier, before, echoes in particular the idea of participation, non-discrimination, and empowerment. And so our theoretical argument is that co-production is a tool that allows us to breathe life into the concept of human rights in policy and decision-making. But I now hand over to Marynka, who will be presenting the empirical part of our research.
Thank you, Pierre. So the research that informs this paper was conducted in two stages. First, we reviewed existing literature on co-production under COVID-19 in the UK, and we distilled some general good practices. We used those to assess the co-produced initiative in the city of York. Through this review, we identified 4 conditions for effective co-production. First, there's funding. So financial support from the local government is essential to ensuring that community groups and volunteers can conduct their work and explore innovative practices, even during times of financial hardship. Second is synergy. Effective co-production hinges on a collaborative relationship between the local authority and community groups, volunteers, professionals, other sectors, which leads into the next one, relationships. So relationships of trust between the local authority and community groups are essential. It incorporates flexibility, for example, in the allocation of public funding. And lastly, commitment. So all parties involved in a co-produced initiative need to be committed to that initiative. And this ensures that if one party decides to increase their input, they trust that the other party is also going to increase their input. Second, we conducted in-depth semi-structured interviews with several actors. So there was 1 counselor, 5 council staff members, and 2 members of the voluntary sector. The interviews focused on 3 broad themes. First, the identification of needs and response design. The respondents described how the public and voluntary sector came together to identify vulnerable individuals and their needs during the multiple lockdowns that were imposed in the UK throughout the pandemic. Moreover, they explained how responses to the needs that were identified were designed bearing in mind the capacity of the actors involved in terms of both financial and human resources. Second, that was the actual delivery of those services. So respondents identified how the services were delivered to end users relying on a referral system, so online or by phone, and deploying a large pool of volunteers across the city. The interviewees also focused on the operational challenges that come with deploying volunteers. For example, they need to be vetted, they need to ensure geographical coverage, and they need to minimize the health risks of volunteers and the people that they are interacting with. And lastly, lessons learned. Respondents described the strengths and weaknesses of the model that was adopted in York. Generally speaking, the collaboration between the public and the voluntary sectors worked out well. They were able to deploy a large number of volunteers across the city in response to a very high volume of requests. But the respondents did identify tension between the council's need to respond quickly to the crisis and deploy their resources and the time that's needed to conduct co-production effectively. Now then, come on, laptop. Okay, so a number of collaborative initiatives were carried out at the outset of the pandemic in York to identify the needs of the citizens and then to deliver the services. These were reported in the York Human Rights City Network Indicator Report for 2020, so I'm happy to direct anyone to that if you're interested. But for this presentation, I want to focus on one specific initiative. It was a case of asylum seekers in a hotel, and it exemplified the importance of stakeholders in co-production feeling empowered to participate in the delivery of rights. So firstly, a number of male asylum seekers arrived in York during the pandemic, and they were accommodated in a local hotel while their cases were being reviewed. Now, government regulations require them to isolate and be tested for COVID-19, and this presented challenges to access to key services that are normally provided to asylum seekers in York. I mean, they were in need of clothing, toiletries, things like that. Their phones were taken away, so they had even fewer ways of getting what they needed. So various actors got together and set up a weekly Zoom meeting to discuss what was working and not working, and then future steps. So they came together to address these challenges. Citizens donated money, clothes, and phones. The local police regularly encouraged the men to report any harassment and affirm their right to physical and psychological integrity and to not be discriminated against. There were two primary organizations, civil society organizations, that interacted with the asylum seekers, and that was Refugee Action York and City of Sanctuary York. But the regulations were still in place to minimize the health risks. But the council relaxed certain bureaucratic rules, and trusted Refugee Action York and City of Sanctuary York to comply with safety protocols as they conducted their work. These organizations empowered the asylum seekers to speak up about what they needed, and then the organizations worked to meet those needs. So in addition to what I mentioned before, their services would include advocacy on their behalf to get their phones back from the immigration authorities, English lessons, social activities, and support with their asylum cases. So this was seen as a successful undertaking by the interviewees because the relationship and communication between the council, civil society, local health authorities, law enforcement, and the private sector were robust enough to co-produce services for the benefit of a vulnerable group during such an unprecedented and difficult period. The situation also showed that certain tasks do not actually require as much time as the council expects, and that many civil society organizations are just as capable of responding quickly as the council is to a crisis. The interviewee from the council said that the pandemic showed an overall willingness to have more administrative flexibility where necessary, and that can lead to a more rapid response. However, there was some tension between the council and the civil society organizations over how best to deliver these services. But we don't have time to go into them right now, but just to let you all know, overall, it was seen as a successful undertaking. And I will give the floor back to Pierre.
Yeah, thank you, Marynka. I basically just want to conclude with a few reflections on the data that we gathered. And unfortunately, we were not able to include these in the draft paper that we sent to the organizers because we are still writing that part of the paper, and we'd also like to give it a bit more thought. But I think that for now, what we can share is, I suppose, an overall observation, which emerged, I suppose, also in relation to this specific case that Marynka just presented. Essentially, one of the things that emerged pretty much from every interview that we did is that there is a bit of a mismatch between what the public sector in New York understands co-production to mean and what the voluntary sector believes co-production to mean. And of course, I'm generalizing now because essentially because there is no systematic approach to co-production within the public sector, whether an initiative is successful, more successful than others, really depends on the, I suppose, the willingness of the individual officer to engage in meaningful co-production. And so you've got some of them that are very keen to listen to community voices, whereas others are less so. But this makes us wonder how different understandings of co-production sit with the idea of participation from the perspective of human rights. And it is important to highlight that participation from the perspective, from the human rights perspective, is not merely a procedural requirement. It is about ensuring that community voices and inputs are considered in setting the agenda of public authorities, because only in this way can the root causes of inequalities be tackled effectively. A command and control approach, as some interviewees from the voluntary sector called it, while allowing community to have a saying in the implementation of services, in the delivery of services, comes with a prepackaged set of priorities. And from a human rights perspective, this neutralizes the empowerment element because it conceives of individuals, people, as merely service users as opposed to rights holders. That is, as passive recipients of the services offered by the council. And I just stop here. And of course, we are very happy to take any questions later on.
Thank you so much, Piergiuseppe and Marynka, for giving us kind of a positive input on this co-produced responses and some concrete examples from your studies that worked out pretty well. Again, I'm collecting the questions for the end because now we're moving basically to the fourth continent as promised. We have Alice Robinson, Naomi Pendle, and Peter Hakim Justin. And they present to us their work on South Sudanese NGOs and local government, also in the light of COVID-19. So let me introduce them quickly. So Peter Hakim Justin received his PhD in the sociology of development from the Dutch University of Wageningen. And his focus and work is on governments and conflict studies, but he's also an expert on environmental science. And Alisa Robinson and Naomi Pendle are both joining us from the London School of Economics, where Alisa is a PhD student with a focus on histories and everyday practice of the South Sudanese NGOs. And Naomi Pendle is their research fellow at the Institute for Africa, and focusing on ethnographic and qualitative research. So I'm happy to hand over to you. And afterwards, we will have our discussant summing everything up and then a short Q&A.
Great. Hi, thank you so much, Katharina. And it's really great to hear everyone else's presentations. You've already given us a lot to think about. I'm going to present our paper. I don't have any slides. I've been really boring. I'm just going to talk at you. And then my co-authors Naomi and Peter are also around to join in the Q&A. So our paper explores dynamics of collaboration and contention between local authorities and NGOs in the response to COVID-19 in South Sudan. It highlights the central role of NGOs in responding to the pandemic, reinforcing and reigniting debates about who bears responsibility for service provision and public health. The paper also considers what distrust towards the virus and responses to it tell us about trust in aid workers and the government, arguing that this highlights the political and social distance between South Sudanese communities and both the government and the aid community. Trust is undermined by the prioritization of a response to a virus that had limited visibility in many South Sudanese communities, at the expense of attention to and resources for many other pressing challenges facing people on a day-to-day basis. The paper draws on data collected during an HCGES-funded study conducted between November 2020 and February 2021. The research team included myself, Naomi and Peter, as well as an exceptional team of researchers in South Sudan, Chok Biel, Latjo Dang, Benjamin Dut Tong, Cholkyu, Rose Mabu, Ngot Mu, and Amber Peter. In total, 99 interviews were conducted across 6 locations in South Sudan, with staff of local, national, and international NGOs and a range of local authorities, including government officials, elders, chiefs, and others. The data has been written up into a policy report for the HCGES, and this paper represents a reanalysis of the data in relation to some of the questions guiding this workshop. The paper also builds on each of our previous and ongoing research, focusing on South Sudanese NGOs, in my case on local authority and local government for Naomi and Peter. So first, just a little bit of context. So in the first months of the pandemic, there were very dire predictions about the possible impact of COVID-19 in South Sudan. The virus was framed by national government actors and international humanitarians as a crisis in need of an urgent countrywide response, guided by the highest levels of government. Schools and universities were closed and social, political, and religious gatherings suspended. This was followed by the closure of airports and land borders and the imposition of a curfew. Restaurants and non-essential businesses were closed and street vendors were banned, impacting many people's livelihoods. Cases of COVID-19 appear to have remained exceptionally low in South Sudan. So as of early June, there were just under 11,000 confirmed cases and 115 deaths. However, extremely limited testing means that we really just don't know the scale of the spread of the virus in South Sudan. At the same time, many other pressing crises affected people in South Sudan in 2020, including flooding, severe hunger reaching famine levels in places, and ongoing conflict. In addition, while the immediate health impacts of COVID-19 have been less pronounced than feared, the effects of social and economic restrictions have been felt severely, with lost incomes and jobs, rising food prices, and a year of school closures taking a heavy toll. Also, as part of the context, in South Sudan, the pandemic coincided with a vacuum in subnational, state, and local county governments associated with delays in the implementation of a 2018 National Peace Agreement. So in early 2020, just before the pandemic was declared as such, the president had announced a reduction in the number of states in the country from 32 to 10, and in the number of counties from 400 to 79. As part of this decision, all previous state governors and county commissioners, so the leaders of the state and local government respectively, were removed from their roles. The president took over the authority to appoint state executives, including some members of local government. However, it was not until a year later, this year, that he started to fill these positions, leaving a vacuum in local governments for most of the first year of the pandemic. In the meantime, caretaking governments were put in place, led by secretary generals and executive directors, though there was ambiguity around the jurisdiction and authority of these actors. At the same time, in South Sudan, local government has long included the presence of both local government staff and chiefs, creating a level of continuity, and in areas controlled by the oppositions, governance continued as before to a greater degree. Overall, by early 2020, when the pandemic was declared, South Sudan was a patchwork of different areas of control that included different state and local government divisions. Firstly, amongst interviewees for this study, there were widespread perceptions that the vacuum in local government had impeded the response to the COVID-19 pandemic. So amongst other things, ambiguity around local government authority led to confusion for NGOs seeking to respond to the pandemic about whose permission was required to operate and to travel to different locations. And a lack of local government leadership was often blamed for significant insecurity outside the towns, preventing organizations from traveling. However, an even more fundamental and long-standing issue shaping the relationship between NGOs and local government actors is that the latter lack resources for salaries, services, and transport, amongst other things. Local governments rely almost entirely on NGOs and UN agencies for service provision and to bring employment to their areas. The reliance on aid agencies to enact a public health response to the pandemic has reinforced perceptions of aid agencies as the primary service providers and as key decision makers in relation to public health. This was felt most strongly in areas further from the political and economic centre of Juba, the capital, but it was acknowledged even by actors in the capital. So in Akobo, for example, an opposition area, NGOs and authorities alike highlighted the limited resources available to local authorities and their near complete reliance on NGOs for the delivery of services. Respondents also highlighted the role of NGOs in decision-making in relation to the pandemic. So a local government administrator, for example, said, NGOs are the ones who came to inform us about COVID-19 and how to prevent it. They came up with the rules and told us what to do. Then the local authority put the rules on paper as local orders and made it clear that violations would have consequences. Raising awareness about COVID-19, he said, was supposed to be the work of the government, but we are not seeing government. And an elder in another opposition-held area described learning about the pandemic from messages shared through sound systems mounted on UN and NGO vehicles. He said, our survival all this time of war and corona is NGOs. The local authority knows that they do not have the ability to help us. Reflecting on a 2016 outbreak of cholera in the area, similarly, he said, the authority did not do anything. They do not have facilities to help the situation. They were only grateful to the NGOs for helping everyone, including them. We became humanitarian citizens, all of us. Similarly, in Yambio, in the southwest of the country, a local Ministry of Health official described how, though she had heard over the radio that there had been donations to the government to respond to COVID-19, she could not access money even for airtime, to make phone calls or transportation. As a result, she said, our hands are tied up. We cannot go to supervise what is happening in other counties or locations. The power of the governor instead has been, in her words, to call and invite the NGOs, who have then worked on renovating the hospital, buying mattresses and drugs, and paying health workers. She reflected, later we expect the government to wake up and do something, but currently most of the people realise that it is through the partners that we are supported in most of the things. For their part, many respondents from South Sudanese NGOs emphasised a sense of duty or obligation to respond to the pandemic, including sharing messages about the virus and how to prevent its spread, because of the government's inability to do so. Across the country, many local and national NGOs and community-based organisations worked to mount a response to the pandemic. They launched awareness-raising campaigns, trained and worked to protect health workers, built and rehabilitated washing facilities, and made and distributed face masks and soap, amongst other things. Some did this at the behest of and with the support of their donors, while others mobilised on a voluntary basis, adapted activities, repurposed existing funds, or collected donations from staff to try and raise awareness about the disease and provide protective equipment. One thread running throughout many people's narrations of their motivations was that the government, with limited resources and in a state of flux, would not be able to respond, and that the communities they worked with would otherwise not be reached with information about COVID-19. There are also differences and nuances in people's perceptions of their role in relation to the state, reflecting different relationships with the state between different people and in different places. For some, there's a sense of wanting to support the state, bound up with ideas of citizenship and responsibility. For others, there was a stronger sense of sidestepping or working around the state, filling a vacuum through necessity. A national NGO staff member in Juba, for example, said, the Ministry of Health alone and the government will not be able to facilitate all the activities, so the organisations around have to step in. Literally, it is like doing your part within society. Another organisation which had made and sold face masks to international organisations and used the revenue to support a subnational Ministry of Health in its COVID-19 response, said the government itself, they just don't have that funding. Their situation is just, they're so desperate. That's why they recognise us and say that we were actually there to rescue them because they were desperate and there was no money given to them for that purpose. The research also highlighted an uneasy symbiosis between local government actors and NGOs. Local governments lacking resources may largely depend on aid agencies for the provision of services, but aid agencies in turn require the permission of local authorities to operate and depend to some degree on their cooperation to work safely. NGOs may operate as powerful public authorities, but local government actors still have the power to facilitate or prevent their work, and in some cases, they are explicitly credited with bringing NGOs to their area, as well as with the services and employment that this provides. In many areas, NGOs and local government authorities worked closely together to coordinate a response to the pandemic. They collaborated in task forces formed at subnational levels, which brought together caretaking local governments, as well as aid workers from international and national organisations. Some interviewees from NGOs felt that the pandemic had led to greater collaboration between themselves and local government and to improve relationships. Others were highly critical of the failure of government to secure a safe working environment, attributing this to the vacuum in local government and the delayed peace agreement. Local government actors may be lacking in resources, but they are certainly not absent, and their presence and decisions were strongly felt. And a final section, the politics and perceptions of the COVID-19 pandemic in South Sudan also raise anew questions of who defines a crisis and which crises are deemed most pressing and worthy of attention. Widespread misapprehension over the reality and risks of COVID-19 in South Sudan is bound up with political critique of government and NGOs, bringing to the fore important issues related to the accountability and responsiveness of these actors. Rumours circulating about the COVID-19 pandemic also highlight the social and political distance between many South Sudanese communities, the government, and the aid community. Perhaps due to a lack of testing and also the overlap of COVID-19 symptoms with other diseases, the visibility of the virus in many South Sudanese communities remained low throughout the first year of the pandemic. At the same time, there were several high-profile cases, including of politicians, and the first case of the virus in South Sudan was an international aid worker. Secondary social and economics of the pandemic on lives and livelihoods, meanwhile, were widely felt, but immediate health impacts of the virus have been less clear. As a result, COVID-19 came to be seen by many as a disease of the wealthy and powerful, affecting people in rich countries, as well as South Sudanese elites and aid workers, and particularly those with resources to travel. As described by a researcher in Akobo, it became seen as a disease for rich people who drink cool drinks and live in air-conditioned rooms. Others believe it to be, quote, a political disease for money only. People also questioned why a disease with such a limited visible impact in their own communities had generated such a large response relative to the many other pressing issues that they faced. Mistrust in aid workers was promoted by the disjuncture between a relatively well-funded, visible response to COVID-19 and the relative invisibility of the virus in many communities. Interviews highlighted a significant degree of suspicion towards aid workers, whether from national or international organisations, ranging from fears that they will be bringing the virus to suspicions of corruption and self-enrichment. In Yambio, for example, a local official highlighted a perception that people who talk about COVID-19 do so because that has become their business, where they get money. The director of a women-led organisation in Yambio similarly reflected that the challenge we have is the belief of the community because they have realised that it was a political kind of sickness. If you wear a face mask, they point at you that there is no COVID-19 and it is you promoting the virus. Many local and national NGO staff members themselves questioned the rapid pivoting of attention and resources to COVID-19 and shared their frustrations at suspended or cancelled funding as a result of the pandemic. 2020 was a perfect storm for many South Sudanese NGOs, with the pandemic coinciding with declining funding, escalating needs, and an economic crisis. Long-standing funding practices amongst international organisations, including short-term projects and a lack of support for organisational overheads or assets, have also undermined the sustainability of many organisations, which are very vulnerable to shifts in international funding and priorities. Suspended or cancelled funding as a result of the pandemic left many organisations struggling to stay afloat, and there were widespread staff cuts. Meanwhile, staff of local and national NGOs, like international, experience being met with suspicion in relation to the COVID-19 response. A former international NGO staff member in Ye said, for example, "I have heard from people in workshops and community meetings saying that our national NGOs are just doing the work of Corona because they are paid, but they know the truth of the matter. There is nothing like Corona." The point overall is not that COVID-19 in South Sudan is not important nor a concern. The many volunteer-led mobilizations around the virus highlight that it was. The challenge is in the prioritization of focus of COVID-19 at the expense of many other issues. COVID-19 restrictions became indicative of the concerns of the foreign and powerful, taking precedence over the many other pressing and deadly crises facing South Sudanese people. As described by one interviewee, COVID-19 has already built a house. It's not going anywhere, and we must find ways to live with it. This research reinforced findings from other studies that vertical, top-down public health responses to single diseases at the expense of other interrelated challenges people face can undermine trust and cause more harm than good. Relatedly, though NGOs play an important role in the provision of services and employment, trust in these organizations is undermined when they are suspected to be following the agendas of donors rather than the communities they work with. Trust building is also consistently undermined by the top-down, prescriptive and precarious ways in which local and national organizations are funded by international actors in South Sudan. That's the end.
Thank you so much, Alice, also for pointing out this difference between the global north and the global south and the perception or the effect of COVID. I would like to take the chance now to hand over to Alisa Bellotti. Not before introducing her, Alisa Bellotti is a historian dealing with contemporary transnational politics and culture, and also focusing on social policy and politics and new forms of identity, and therefore very much fitting to be the kind of commentator or discussant on this panel. So Alisa, I hand to you, and afterwards we can have a small Q&A.
Okay, thanks, Katharina. And thank you all to the different groups presenting your research. It was very interesting reading for me. While reading the papers, it quickly became clear to me just how well they all fit together, which is great. It makes my job a little bit easier. Collectively, the papers show just how impossible it is to separate the danger posed by the disease itself and the hardship caused by these knock-on effects of public health measures that are meant to slow the virus's spread. And that this causes then problems in the NGO government working relationships, and that's true whether we're in the global north or the global south. And yet, based on these papers, the diversity of the problems in these relationships between governments and the NGO CSOs is really striking. So on the one hand, we have Israel, where the civil society organizations are dependent on the government for their funding, a situation that leads to suspicion and mistrust of nonprofits among the government officials. And then the situation is exactly the opposite in South Sudan, where the local governments are almost entirely dependent on the NGOs for their funding, and it sounds like even for their policies. In both cases, it's the dependent party that loses the public's trust. But as the papers demonstrate, this seems to happen for entirely different reasons, and I assume will therefore call for very different remedies to fix these problems. Across all four papers, trust is the common theme. Public trust in governments and also governmental trust in nonprofits. The danger that each of these papers outlines is that public health measures that are meant to save lives may actually erode trust in institutions, which government and or nonprofits, and in the long run, that this might even cause more harm than good. These papers therefore address an extremely important question, which is, how has the pandemic altered the trust that makes this NGO government partnerships possible and allows them to work together to address the needs of needy communities? So taken together, the papers collectively suggest that there are specific and identifiable ways in which this trust is breached, and ways that we can try to identify, perhaps. As a first suggestion, one way seems to be through unmet expectations. So in South Sudan, for example, the public expects widespread sickness. It doesn't materialize. And then the public very rationally concludes that the lockdowns and the restrictions probably benefit someone. It's not them, so there must be corruption. In York, people expect that their offers to volunteer during the crisis will be valued. They're disappointed when the council doesn't need them because there's not enough volunteer positions even to go around. And then their confidence in the ability of the council to organize volunteer efforts is decreased. And in Israel, there are normative expectations on the part of government officials that CSOs should be more rationalized and streamlined in order to receive funding. The CSOs remain inefficient, and government officials trust that their trust that the CSOs can accomplish what they claim they can is decreasing. So a second way in which trust seems to be breached in these papers is, well, the potential for an inverse relationship, it sounds like, between trust in government and trust in NGOs. This comes through most clearly in the work on Brazil, although I understand that it's not finished yet. But there is this one hypothesis, which is very interesting, that as trust in NGOs increases, the government is seen as less effective, maybe rightly so, and the level of trust decreases accordingly. So this is a problem mainly when it moves in this direction and trust in democratic institutions is harmed. So questions that I would pose to the group is there really such an inverse relationship? Am I, for instance, overstating the importance of the public's expectations in crisis management? And a third question, is there something about pandemics which is perhaps different from other crises? Is there something unique in the way that trust is either built or undermined during a pandemic than, say, during a war or hyperinflation or a constitutional crisis? I do have a bit more, but if we want to go, maybe we should just go to questions.
Great, perfect. Thank you, Alisa, for this amazing summing up, putting everything together, and also proposing some questions. So I would give the panelists maybe to pick up on also on the last question, Alisa, like just throw into the digital room if there's a difference between pandemics and wars or other crises. Maybe you want to pick up on this and we make a quick round and everyone gives a short input.
I'll give a short response, but I think a short comment. Unfortunately, we have too many wars in Israel, so you cannot be adjusted to wars because every war has its own consequences and results. But the pandemic was totally different. I think it's such a major event that nobody expected. And actually the government was not ready. No, even in institution, in governmental institution, the army, nobody was prepared. Even some of the authorities were, during the years, lost many of their responsibilities and authorities. So nobody was prepared to such a big event, and it was very surprisingly. And I think it's a little bit different. Unfortunately, I think for wars, I think there are some work plans how to respond to the war. But in our case, I think at least the government was totally, I don't think there was a work plan. There was no plans or alternatives. In addition, the political interests that were involved in the decision-making process of the government actually was very, very tough for the government. They didn't actually respond to this political pressure and was bewildered by this political interest. So I think there is a difference, although both of them, I don't like them, but I think for wars, I think we prepare, like I think I remember the Latin vote, if you want peace, prepare for war. But in the case of the pandemic, I think it was totally different.
Okay, perfect. Natalia, maybe you want to make a comparison in Brazil, if it's comparable, or?
My co-author Leo will take the question.
Great. Okay, so to be honest with everyone, it's such an unprecedented crisis that it's hard for us to compare to other events that may be comparable in the case of Brazil. We've had sanitary crisis before here in Brazil. For example, diseases related to sanitation, diseases related to tropical viruses like malaria and dengue, which are very common here in Brazil. The Zika virus, which is a new virus that's believed to be very, very dangerous and believed to be a risk of a pandemic. And we also have had economical crisis, but the thing is here, we have a combination of both crises, and it's difficult for us to understand what are the limits of the government and what are the limits of trust in institutions. I think our work contributes a little bit, even though we still need to get a lot more evidence on this topic. What I can say to you regarding the other questions is that indeed our results are mixed in a sense. In one hand, we have results that the intervention of the NGO increases trust in the NGO itself and trust in stakeholders related to the NGO. For example, the community leaders that are partners of the NGO. This is an interesting result. On the other hand, we have mixed results related to trust in government. It seems that those who were benefited by the intervention start to trust a little bit more on government information. Actually, they do not trust in government information related to the COVID pandemic. The results are null on this aspect. However, we do find evidence that they respond more positively towards what the government has been doing to fight the COVID. So treated families, those who received the program, they evaluate the government better, and they evaluate the work of the NGO and the work of the community leaders better as well. We don't know if these are only spillover effects. We're still trying to understand our results, and I think the next step is to investigate this, and we're trying to do this in the current work that we are developing. But I would say that we need to be careful with our results so far, because results can be mixed, and we're not sure if trust translates into evaluation and the other way around. So I would be happy to discuss with you guys more on this.
Okay, thank you so much. Maybe Peter and Alice, like a comment from Sudan, like you can decide who wants to comment on it.
I think Peter will come in for us.
Okay, thank you very much for hosting us and for giving me this opportunity to briefly comment on the general remarks made actually during the comments. Maybe like you have heard during the presentation, the context of South Sudan is totally different. That's why actually the way how COVID was perceived, how it was managed was actually totally different from the global north and other contexts. Basically, because actually the political context, first of all, there was an ongoing civil war, and then we have COVID. And at the same time, actually, as some of you may be aware, South Sudan was at a certain point up to 98% dependent on oil revenue. And as a result of the civil war, actually, then there was no money. And that was why actually, as others explained earlier, that the total dependence was almost on NGOs. And then again, in contexts like this, where, and in addition to that, actually, 2020, South Sudan experienced huge floods, which displaced actually many communities. So then COVID comes in, and then there was a very sharp shift in programming, whereby the attention was, okay, international NGOs working in the country, most of them left to their countries. They're trying to coordinate remotely using national NGOs, which, as some of the presentations had highlighted actually early this afternoon, that it has been very challenging because simply not all NGOs have got access to the net. And then the question is, what should actually have priority? Is, for example, okay, if you come to cases like isolation, you test and all this, then you should isolate. And you are talking to communities which actually survive on daily basis. I don't go out, I will die. So then the question is between dying of hunger while isolating or just going out and then maybe risk getting COVID or not. And that is why the mixed perception in terms of how true is COVID or how true is it not. Again, it was reflected like the figures mentioned in terms of those tested positive or those who died is really minimum or close to nothing, simply because there are no testing facilities in place. And even if they are testing, people are so scared that, okay, if I'm tested, I'm positive, then what? Of course, there have been some attempts that, by local NGOs of trying, to support those who are isolating by providing food and drinks. But of course, only in the capital city like Juba. But then as you go out, there is virtually nothing. And especially that this happens in a context where there are no middle level and local government institutions in place, simply because of the restructuring that was happening in the government. So these are actually some of the challenges that South Sudanese faced. And the thing is, okay, it's not absolutely that it's, okay, lots of people died because of the COVID, because of the pandemic, but then the question is actually choosing which way to die maybe. Because you have the pandemic can kill you, but other things are killing you as well. And then shift, okay, if you equate COVID to other multiple disasters that are already happening, and then the shift from NGOs programming just to focus more on COVID by itself, I think was creating even negative relationship between those who are supposed to be saved and the donors. So maybe I can just end up here for now. Naomi or Alice may have additional comments on that.
Perfect. Thank you also for these insights. Marynka and Piergiuseppe, do you have a short response for Alisa's input?
I can say just a couple of words and then maybe you hand over to Marynka if she wants to add something. So in relation to the question of whether the pandemic is like different from other emergencies, I think yes and no. Like I think part of the reason why I think there was such a prompt mobilization of volunteers was precisely because the council and the civil society in New York had a previous emergency response program that was activated in the past, for example, in relation to floodings in the city. And I think that served as a bit of a blueprint for the current response. But then, of course, COVID-19 sort of raised a lot of other additional issues. And I think if there is one emergency perhaps that can be compared to COVID, and especially in this context, is the climate change crisis. No? And I think a lot of studies are being conducted right now in the UK in relation to how we can use certain lessons that we've learned from the response to COVID-19 to respond to climate change. In relation to the relationship of trust, I think here in New York, trust, the issue of trust in a way is twofold. So I think that the pandemic in some way deepened the rift between civil society and the council, and undermined a bit that trust, especially in relation to certain issues such as volunteering and stuff. So I actually found it quite interesting that most of you were saying like, oh, thanks for presenting like a positive example, because I mean, I understand it's a positive example in relation to others, but actually it was part of the civil society here in New York was very critical of the response of the council. And then the other issue is the trust that the public places on institutions. And I think there was a bit of a race between the voluntary sector and the council in providing certain services. So for example, food distribution or medicine distribution. I think one of the observations that we made was that the council wanted to sort of retain that competence, but the voluntary sector was saying, "Oh, but we do it better." And so, you know, I think it was, from the council's perspective, it was a matter of sort of establishing their role in relation to the public. I don't know if Marynka wants to add something to this.
Yeah, jumping off of what Pierre said, on that issue of trust, one of the difficulties that came about that was revealed in the interviews is that the council it's not just this monolith. There are different departments and different teams, and some teams are much more willing to protect the relationships that they have with the citizens and other organizations, and others are still very much tied to that, as Pierre said earlier, that command and control type of perception towards the citizens and the voluntary sector. So even just within different branches of the council, you could see that relationships that were strong before were, at least it's not strengthened, but they were further maintained, and relationships that were already damaged, they became even more damaged as a result. However, I do think that the higher ups at the council do have a pulse on this, do have their fingers on the pulse of this dynamic. For example, with the volunteers that weren't properly utilized at the outset of the pandemic, and the voluntary sectors weren't called in as soon as this happened. A actual building for the main voluntary organization in New York is currently being built to mitigate the damage that happened.
Okay, great. As we are a bit running out of time, I would suggest to send like urgent and pressing questions via the chat function that we have privately to the panelists you want to address. Nevertheless, I just want to sum up 2 questions and give them to Hillel Schmid. Maybe this would be the closing of our panel, because Hillel, maybe you thought you received a big bunch of questions. So maybe to sum up 2 questions, and you can answer to it briefly. We had from Pierre the question, or if this mistrust of the Israeli governments towards CSO is affecting specific types of CSOs. And along with this question goes also the question of Marynka asking if these CSOs that are limited, if they are finding some ways around it, like do they have like possibilities to bypass the limitations by the government?
Actually, the government, in my paper, I refer mostly to the 80% of the organization that provide services. There are, of course, about 10% of the organization, 6 to 7% of advocacy organization and social change organization, but most of the organizations are really doing provision of services. And to them, I relate in my paper. Unfortunately, I think the advocacy organization, the social change organization, didn't get any money or any grants from the government. The grants went only to the provider of the services, and about them I'm talking in my paper.
Okay, great. Okay, I would like to thank you all very, very much for this fascinating panel, this quick travel around 4 continents. I'm happy to distribute papers, provide contacts, anything you need. Keep in mind that this is a workshop, right? This is also great that we have presented work in progress. So maybe we can all meet together in a year and see where we're standing. Thank you very much again for this first panel, and also for Alisa to bundling it. We will convene on next Monday, the same time, 6 to 7:30, Haifa time, and then take a little bit of a look to the macro perspective. Now we had very interesting examples from different countries, but then we will open it up. I already see we have Anthony Demate here, who will speak also on Monday. And I'm very happy to see you all then again. And we have a third day, Wednesday, June 30th, also from 6 to 7:30. Also very happy to have you then. This will focus a little bit more on anthropology and look into from publics to civil society. So thank you so much also to my colleague Michal Bengal, who is the technical administrator and supported us wonderfully today. And also for Deborah for being with us all the time, and Omri, who is also with us. Okay, thank you so much.
Thank you.
Hope to see you.
Thank you very much.
Thank you very much.
It was fascinating.
Thank